To call upon our next speaker, Dr. Jitendra JETHANI, a very senior colleague and a good friend. So he'll be presenting on the Prism holding device, and I request Dr. Madhukar Reddy sir to please be the discussant for this case. Oh, he has bought some practical this thing also for us.
This is bright. No, I'm just showing. You can use it and see what I'm trying to
Okay.
show. So,
Even for the moderators also. Yeah.
good morning, everybody. Yeah, respected judges and respected teachers. I would be speaking on a device which we have made for measuring large angle strabismus. We know that in India at least patient comes late to strabismologist, and large angle strabismus is quite common in India. We all have seen big angles, and what happens when you are measuring large angle in your prism set, you only have a 50 prism, not more than 50 prism. So what you need basically, like I will show you this small video. What you need basically is that you need to split the prisms, and one person has to hold the prism, either your assistant. You obviously cannot do it because if you hold the prisms, you cannot do the cover test. So some assistant will be holding the prisms. They may not be maintaining the frontal position. You need a assistant, and if you have to measure hyper, you need another prism. So what we thought was that we need a solution to this daily problem that we have. So what we did was we took a stick, we put a plate on it, and it has a adjustable section. We'll see the video of that. This is how the patient will hold the. It's not a very very high tech device. It's just a more of a common sense kind of device. What we have done is we have taken a stick. Patient is holding the stick. So this was the first prototype which we made in aluminium, then we made it in steel, then we finally made it in wood because it has to be lightweight. So this is the first prototype, and I will be showing the final prototype. So this is the prototype which we are currently using. Yeah, so if it runs, video is not running.
No, please play it. Click on it. Acha, it's taking time.
It's taking time. So we are a little too quick in the pressure of time. So, so basically the device has a central stick, has two holders. You can move the holders because if you have esotropia, you have to bring the two holders close. If there is exotropia, you have to bring them out. There's a small screw here. You can tighten it so that it stabilizes in the position. You can take out the prism. The same holder fits for vertical prism as well as for horizontal prism. Should we reload the presentation? It's not, the video is not working. So basically, you can move it. You can take two prisms. I think we have made the point what we wanted to make.
Yes, we have.
We can. This is basically, and then I have the more of details of what we did. We tried to use it in almost 100 patients in the OPD. We found a good correlation with the existing method of holding the patient. Somebody is holding, and we are using a prism holding device. It has actually a lot of usefulness for people who are doing strabismus, because if you want to measure AC by A ratio, you can put another flipper on it. You can use plus 2.5 diopter lens and do an AC by A ratio. Two horizontal prisms and another vertical prism you can hold. So it has a lot of utility for us because patient is holding the device. Now your both the hands are free. You can use accommodative target. You can do the cover test. So it's quite useful for us in day-to-day practice. So that's it. I think yeah. The presentation has got smitten with the device. I think we can, if there are any questions, we can.
Yes, doctor. No, you have conveyed it well.
Yeah, it's a very convenient and very common sense contraption to use.
Yeah, so this is just to, I think, yeah, we can discuss, sir, if there are any questions, we can take questions.
Any more comments from other judges, audience?
No comments. Yeah. We would try to make it commercially, but we have not patented it because the cost of patent would be higher than the amount we will generate. At this point of time, we have around 1,000 pediatric ophthalmologists. We won't be able to sell more than 2,000 devices. So we thought that it would be better that we don't patent, make 2,000 devices and give it to pediatric ophthalmologists.
That's a
much
great
easier.
idea.
Very nice. Very nice. Yeah.
Very nice.
Thank you very much. We go on to our next speaker. Thank you. Next speaker is Prateek Nishant, and we have Dr. Jagdish Rana as a discussant, and the topic is vectoral analysis of iris photographs for assessment of ocular torsion in cyclovertical strabismus.
So good morning, all. Thank you for the opportunity, ma'am. And so the diagnosis of torsional strabismus is not always straightforward, and the current standard for quantitative assessment of the disc is the disc fovea angle as measured on fundus photography. Recently, distinctive iris features are being used in a variety of applications to measure the torsional change. And a need was felt to develop a simple, non-invasive, and affordable technique to measure the change in ocular torsion using readily available consumer-grade DSLR camera and PC software for capturing and analyzing the iris photographs. This is the first known study to capture binocular iris photographs in Indian eyes. So previous studies, as seen in this review of literature, entail mydriasis, time delay, increased costs, inconvenience in uncooperative children, and in those with hazy media. Uh, there's a described effect and methods of correction of head tilt also, and the change in ocular surgery with ocular torsion with surgery is different as regards the objective measurements and the subjective measurements. So the lacuna that we found was that there is paucity of binocular photographic studies and none have been done in Indian eyes. So there is a need to develop a simple, low-cost, non-invasive technique and to validate and test its accuracy. These are the objectives. In particular, the secondary objective was to compare the accuracy of this measurement with the standard technique. And but before that, we needed to develop the method of binocularized photography using the DSLR camera and to define the photography settings thereof. So this was a 1-year prospective comparative experimental study amongst subjects more than 8 years of age with diagnosed cyclovertical strabismus. Uncooperative, unwilling subjects or those with ophthalmic pathology precluding imaging were excluded. So 30 eyes of 15 such patients were pre and post-operatively assessed, and difference in torsion was found using the two methods. This is how the photographic method works. So the photos were taken in a dark room with the patient seated erect. The face was perpendicular to the floor, parallel to the wall behind. Frankfurt lines were parallel to the floor. Residual head tilt was minimized using a spirit level at the patient's forehead. And the camera was tripod mounted with the lens level with the patient's eyes. Two flashlights were directed from 45 degrees inferotemporally as seen in the figure. Equipment and settings were as shown during photography. The head tilt was minimized again, and these are the photographic settings which were found with empirical experimentation. We enhanced the images, marked the ellipses and iris landmarks, measured disc fovea angle. We read the pixel coordinates of the iris landmarks and the slopes of lines joining the pupillary centers to these iris landmarks. The iris torsion angle was calculated in Microsoft Excel using the average of 4 iris landmarks. These are the demographic characteristics. 30 eyes with various diagnoses were included, and objective X cyclotropia was seen in 10 eyes and in cyclotropia in 5 eyes. These are photos of the two methods applied to one of the cases. The absolute fundus difference and the absolute iris difference were calculated, and the difference between the two methods was derived and compared. The the distribution of the difference between the two methods was normal, as seen by Gaussian kernels, QQ plots, and Shapovalov test. The mean difference was 0.150 degrees, as seen in this plot, and it ranges from minus 0.5 to plus 1 degrees interquartile. The two one-sided tests based on the Wells t-test showed the equivalence of the two methods. Methods showed strong correlation as seen on the Spearman's correlation coefficient as well as the bland Altman analysis. So binocular photography represents more physiological state of cyclofusion. There's difficulty in vectorally analyzing the iris pattern for assessment of ocular torsion in patients with extremely dark iris. And only one similar report by Felius et al. In 2009 had done a preliminary assessment of feasibility of such a method in Caucasian eyes. By comparison, our study shows that in 30 eyes with various diagnoses and various surgeries, this method works with the arrangement as described. This is the first study describing the camera settings for binocular iris photography in Indian eyes. Thank you.
The discussant, Dr. Rana, you have anything to ask him?
Basically, I am not a
I know.
strabism specialist.
Yeah, yeah.
But is there any study published or any other method, standard method for this, established method for this?
So for the assessment of cyclotorsion, sir, there are objective methods and there are subjective methods. Subjective, in fact, means that the patient reports whether he's he's seeing a torsional strabismus or not. An objective method tells whether we are actually seeing the torsion of the eye. So there is no standard of a default value which the torsion can be quantified. We can only quantify the change in torsion pre and post surgery. So as of now, that is being done by the fundus photograph. The basic limitation of using a fundus photograph is that you can capture one eye at a time. You cannot capture binocularly. The other thing is that an element of proximal convergence occurs whenever you pose the fundus camera onto the patient. So that is one aspect which makes all these methods non-physiological. Binocular photography, by comparison with a camera that is quite far away from the patient, makes it more physiological, and therefore this method is more more practical and more accurate in the true sense.
Any international study published?
No, sir, previously only one study has described this method of binocular iris photography. That was in Caucasian eyes, and that compared it with the retinal photographs also. That was done in 4 eyes with inferior oblique overaction, that's all. And the photographic settings were not described. Caucasian eyes, as we know, have light iridis. There is no description of illumination used. There is no description of what magnification was used, what shutter speed was used, what was the exposure compensation. All those settings have been defined in our study.
Thank you.